Welcome back. This is the CTV News. We continue with an initiative by the Ministry of Health to honor those who are on the front lines of treating patients with non-communicable diseases. A special presentation was made by Nurse Shallery to the successful participants in a training program aimed at improving the care of patients from non-communicable diseases.
Indeed, I am delighted to inform you that you participants, trainees, are our reason for this very special occasion. Having come a very long way, you are now self-managers, that is a planner, problem solver, decision maker, and better communicators. I commend you for your patience, your perseverance, and motivation. I urge you to use this knowledge and skills that you have acquired these past 6 weeks to manage yourselves, encourage others, and assist your family, the community at large, to live better lives by using the self-management tasks in your toolbox, the tools in your toolbox, to break any element of the symptom cycle.
Also present at the event was Dr. Amanda King, who stressed the need to be trained well enough to deal with emergencies in the absence of a medical doctor.
Doctors and nurses are very good at taking care of you when you have an acute illness. You're in hospital with a chest infection or a heart attack. But who takes care of you day in, day out when you have diabetes or hypertension, lupus, rheumatoid arthritis, whatever? You may choose to be a victim of your condition. You may grieve for your life previous to the condition. You may complain or isolate yourself. You may try to ignore or deny that you have a problem. That's a choice, one that makes not just you, but your family and friends unhappy, and inevitably leads to more complications for you, greater cost to you, less productive work, and sometimes unemployment, as well as earlier death.
Meanwhile, the Minister for Health, Alvina Reynolds, presented some sobering statistics on the impact of non-communicable diseases in St. Lucia.
Out of the 10 deaths, every 10 deaths we get 8 being as a result of non-communicable diseases. The 10 leading causes of death accounted for 89% of defined deaths. And we speak of, in men, for example, in 2012, cardiovascular, 182 men. Neoplasms or cancer, 135 men. Diabetes, 36. For women, cardiovascular, 199 women. Cancers, 122. Diabetes, 51. And of course, I'm sure, as I call on numbers, that's a problem with statistics sometimes. You see it as numbers. But behind each number, it's a face.
The director of the National Insurance Corporation on Monday, 1st December 2014, wrote to the President General of the National Workers' Union expressing agreement with his sentiment that negotiations resume at the soonest. The director's letter was in response to that of Friday, 28th November from the NWU, which communicated displeasure with the head of the NIC negotiating team and a need for early resumption of negotiations. The last round of negotiations was held on Thursday, 20th November 2014. This was the 9th meeting since the NWU first submitted its 23 proposals to the NIC on September 3rd, 2013 for a collective bargaining agreement covering the period from 1st January 2012 to 31st December 2014. The NIC has also put out a statement detailing the negotiations. The NIC and NWU negotiating teams commenced negotiations on October 23, 2013 and have held 9 meetings to date. The union submitted a proposal of 23 items. 2 items were withdrawn by the union, 2 were considered non-negotiable, 1 deferred, 9 agreed, 3 were deemed policy decisions, and consequently the parties agreed that these items could not form part of the negotiations. The outstanding issues included car allowance and mileage, vehicle loan interest, shift premiums, salary adjustments, and gratuity proposal.